Dr. Jaffe, could you enlighten us about what actually causes autoimmunity and what can one do about it?
Well, when we say autoimmunity, we mean self-attack. This means too much defense burden and not enough repair daily going on within the immune defense and repair systems. But I want to go upstream from that. I want to talk about the real meaning of autoimmunity and why it's so pervasive today. When you say autoimmunity, you're meaning anything that ends in itis. If you're saying autoimmunity and repair deficit, that applies to a wide variety of chronic illnesses from diabetes, type 1, type 2, and type 3. Now, type 3 diabetes seems to be senility because diabetes in the brain seems to be a major cause of Alzheimer's senility. How about arthritis? Rheumatoid arthritis, osteoarthritis, juvenile arthritis, any of the joint afflictions with pain and swelling that are diagnosed as arthritides are included. How about the skin, eczema, and psoriasis? How about the brain with multiple sclerosis clearly now being an autoimmune condition? And asthma, a lung breathing problem condition. Now, you can, of course, treat the symptoms as is commonly done today, or you can address the causes. Now, there is an Autoimmune Diseases Association, American Autoimmune Related Diseases Association, called ARDA. They say at least 50 million Americans are suffering with an autoimmune disease. And the cost is $86 billion a year. Now, these are probably numbers from some time ago and maybe conservative. If we look carefully, I think it would be at least a third of the adult population, roughly 100 million or more, are suffering and afflicted by upstream autoimmune conditions. These are self-attacking conditions, but they haven't yet been diagnosed. Now we get into the challenge of incidence and prevalence. There's how much problem there is in the community, and then there's how much has been diagnosed. Generally, about half of the problems get diagnosed, and the other half afflict people. So I want you to understand the immune defense and repair system in regard to tolerance and intolerance. I suspect you want to be more tolerant, and I want you to be more tolerant, which means no immune defense and repair reactions by LRA cell culture. It's very important to get the T cells and immune complexes and harmful, not helpful antibodies, and that can only be determined by cell culture. Fortunately, we've done over 100,000 specimens and 30 million cell cultures. We have the most precise, accurate, reproducible, sensitive, specific, and reliable in terms of setting forth a 6-month plan to rehabilitate the person, to increase repair and decrease defense work that needs to be done. And so you can tame autoimmunity. A very common autoimmune condition is thyroiditis. I remember a colleague who called me because his patient had thyroid antibodies that were measurable in the many thousands, which means a lot of antibodies. The person needed more than one 6-month plan, but within a year, and then again at 18 months, we confirmed the absence of antibodies because the blood thyroid barrier had been renewed, restored, and repaired. And when the blood thyroid barrier is repaired, the anti-thyroid antibodies stop being made. They are a sign of a need for repair. They are actually trying to help the body do repair, but the body doesn't have enough antioxidants. It doesn't have enough minerals like magnesium with uptake enhancement using choline citrate. The body needs essential nutrients all over, but especially in the very energetic immune defense and repair system. So autoimmunity is all too common. Autoimmunity is a choice. Autoimmunity relates mostly to lifestyle and epigenetics, which is 92% of your lifetime health under your habit control. Your daily living choices matter. So if you know anyone with autoimmunity, if you have autoimmunity, if you want to avoid autoimmunity, follow our guidance, Nature's Alkaline Way and Nature's Pharmacy. I'm Dr. J, and I'm living this way for years and feeling and functioning better without autoimmune ills.